Do you know how pregnancy feels like? Well, it varies from nausea and vomiting to breast enlargement and weight gain. Now, there are 5 important questions that you need to ask your patient before making a diagnosis. Firstly, you need to ask the patient about breast enlargement, nausea and vomiting, vaginal discharge or spotting, pelvic pressure or cramping, fetal, kicking, fever or chills, burning or frequent urination, and ankle swelling. Secondly, you should ask patient about the date of her last menstrual period and her age. Thirdly, you may also ask your patient about your family life and whether this pregnancy was planned. Now, one more important question you need to ask is about his medication history. If your patient is taking any medications, particularly fertility drugs, well, this is because this particular condition might be the result of adverse drug reaction to any of these drugs. Lastly, you should know if patient or anyone in patient's family has had conditions such as diabetes, hypertension, previous blood infections in pregnancy, sickle cell disease, heart disease, rheumatic fever, drug addiction, previous uterine or pelvic surgery, previous cesarean delivery, kidney disease, thyroid disease, vaccination for rubella or history of rubella, genetic disease, Down syndrome, and multiple births. Now that you are well aware of the symptoms of your patient, your main role starts here, because you have to examine the patient. Well, this physical examination includes blood pressure, weight, pelvic exam, checking limbs for varicose veins or swelling, examining the position, size, and heart rate of the fetus. Do you know what is varicose veins? Well, these are enlarged and twisted, often appearing as a bulging, blue blood vessel that is clearly visible through the skin. Varicose veins are most common in older adults, particularly women, and occur especially on the legs. Additional points that patients should consider about pregnancy. Common milestones at different points in a pregnancy. At week 16, the fetus begins to move and abdomen will likely be visibly larger. At weeks 18 to 22, the fetal heartbeat begins to be heard. During visit of your patient should be tested for rubella and syphilis, as well as chlamydia and hepatitis B. You should monitor pregnancy particularly closely if any of the following are true. Patient is younger than 18 or older than 35. A patient has a history of German measles or a skin rash with swollen lymph nodes in the first 12 weeks of pregnancy, or a patient has a history of miscarriage, pregnant within the last 12 months, or given birth to very tiny, very large, or premature babies, or a history of multiple ectopic pregnancies in which the fetus is implanted improperly. Patient is obese or patient of high blood pressure, or have an abnormal pelvic exam. Pregnancy is unwanted or unplanned, or have difficulties in family or personal life. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required. That was all about the differential diagnosis of pregnancy. Stay tuned to sqadia.com for more precise and knowledge-stuffed videos.